Hello and welcome back to another episode of Rapping with the Rep. I'm State Representative Ken Gordon, and I'm here with our State Auditor, Suzanne Bump. Welcome to our show.
Thanks, I'm delighted to be here.
Thank you. I'm excited to have you here as our guest. As our State Auditor, my first question to you is, can you describe for our viewers the Office of State Auditor, what you do, how it's different than financial auditing that I know a lot of people sort of equate the office with, which isn't really the case?
No, that's right. So the State Auditor is one of 6 constitutional offices. I get elected every 4 years on the same ballot with the Governor and the Attorney General, etc. And the role of the Massachusetts State Auditor, as you suggest, is not to do financial accounting. We aren't keeping track of the state's balance sheet. We do care and use financial information in our work, but the questions we ask go beyond how much did you spend? We want to know how the money was spent. Was it spent according to the rules? And we want to know what the outcomes of the expenditure of state funds is. Are the taxpayers getting what they paid for? Are agencies running their programs with integrity? Are there fraud protections? So how is it that we are ensuring that state money is being used appropriately and effectively?
How are some of the ways that you go about doing that?
Well, the law requires us to audit every department on a 3-year rotating basis. And so we have become pretty sophisticated. We're still in the process of doing this, but to make the best use of our resources, we use data analytics, taking the financial information, but also payroll information and operational information together, understanding how that relates to the agency's mission, the programs that it has, and we identify the riskiest areas of operation in a department. We consider other factors such as issues that the legislature might be interested in having us explore, or the general public, and we use that as the foundation for our audit plan.
What interests me, or is interesting to me, is that you have a completely independent, separately elected office.
Right.
So you're really not beholden to an appointment from a governor or the legislature or anyone else.
No, and that is the case with virtually all state auditors. There are a few of them who are actually appointed by their governors, but the function of state auditor has always been part of state government, but it wasn't until the middle of the 19th century that the office was created. And when it was first created, it wasn't an elected position. It was actually an appointment that was jointly made by the House and the Senate. The idea, of course, being that although the function is within the executive branch of government, it needs to be separate from the treasurer and from the governor. A few years thereafter, it was decided that it should be elected rather than appointed. Although more than half of the state auditors around the country are appointed by their legislatures, which is the model that the federal government has. The Government Accountability Office responds to Congress. But I don't respond directly to the legislature. I work with you folks a lot, but I'm responsive only to the public.
And that's important. You respond to the public and the voters.
Right. Yeah, it really keeps the politics out of it. And then to ensure that politics is kept out of it, and that we are operating objectively and independently and with integrity and are doing quality work that everyone can rely on. The State Auditors Association every 3 years does peer reviews, and we have auditors come in from other states to make sure that we're following the rules ourselves.
And that when we first met last session, we were talking about an issue involving the Department of Transitional Assistance. And what impressed me is, first of all, you're not involved in essentially the blame game.
Right.
Your job is to say, okay, what's going on and why?
Right.
How do we get into a situation? And I know there was a lot of media coverage about some waste or potential waste, and I think that's an important word, potential waste in DTA that you identified, saying there are certain procedures not being followed, and if things all were, as worse as they could be, it would be as significant as some of the numbers you mentioned.
That's right. So when we did our audit of the Department of Transitional Assistance, we wanted to find out really how strong the fraud prevention programs were there. And so one of the elements, of course, is fraud prevention is just making sure that people who are applying are who they say they are, and whether they are income eligible, and whether they're really residents of the state. And we found that the agency wasn't always running through its checklist. And specifically, one of the most glaring, and I think the part of the audit that caught most people's attention, was the fact that they weren't always checking Social Security numbers. And so some people were using Social Security numbers that had belonged to people who were long dead. In other cases, there were multiple people using the same Social Security number. In other cases, there hadn't been a Social Security number that had been assigned to the person. They were supposed to apply for it, but then the agency never got back in touch to see whether they really did, and they really were who they said they were. So that element of potential fraud and abuse was there, and it needed to be fixed. And you're right, some legislators said, well, gee, there's not that much money involved, even if everything was as bad as you said it was, it's not that much money. And that's not the point.
Right.
Because we need the public to have faith in these programs if they're going to be available to the people who really do deserve them. And every dollar that some fraudster takes away from the program is a dollar that's not there for somebody that we would agree we would want to help.
Yeah, I didn't hear from colleagues who said that wasn't that much money, because it was that much money.
Oh, believe me, there was.
Well,
I heard from one couple particularly.
Well, from my point of view, though, the issue was that we were talking about a small percentage
Right.
that created the problem, and of course, if you're focused on the small percentage, that becomes the conversation.
Right.
However, what also impressed me from what you said was that we had the software, we had the programs
Right.
in place if they were just used.
Yeah, that was one of the most surprising things that we found in the audit, is that and particularly when we were looking at potential food stamp abuse, that the food stamp program would kick out reports on a monthly basis that would show where food stamps were being used, and could be used, therefore, to identify folks who were, for some reason, taking their full food stamp benefit on the day that it became available and spending it at a convenience store attached to a gas station 25 miles from home.
Right.
That suggests that they're not using the money to feed their family, and they're going there and they're exchanging their food stamp benefit for cash, and that they're part of a fraud ring.
Right.
And that kind of information was available to the agency, but they weren't availing themselves of it. They weren't using it to detect potential fraud.
Did you find they weren't trained to use it? They didn't realize they had it?
I think in some cases they didn't appreciate. I think for the most part they didn't appreciate what they could do with it, and so they weren't trained to use it.
Yeah,
Yeah.
I know that we want our government to run as efficiently as possible, but sometimes in running efficiently, we also need to focus in on the expertise that we need.
Well, and that's a concern that has really been driven home to me over the past 5 years of doing this work, is that we don't have a bunch of incompetent people running state agencies, but the problem that I see most often is that we actually don't devote enough resources to what I think of as accountability measures in state government. We don't make the best use of technology. We don't have enough people trained in its use. We don't have enough people in many cases in these roles. When I was first in government, which was, shall we just say, many years ago, as a state legislator, agencies had many more people who were devoted to internal controls, to making sure that agencies were following the rules, and to make sure that state contractors, were following the rules. In the interest of reducing payrolls, a lot of those positions have gone away, and that's allowed for the increased incidence of waste and abuse, and opens the door to fraud.
Right, and it's a crying shame.
It is.
Because you look at a report you just issued this week about a bridge in Gloucester where there just wasn't enough due diligence done. $2.6 million could have been saved.
Right at the outset, in an effort to save money on a bridge repair project, they decided, and this goes back to the Romney administration. That's how long this project has been underway up in Gloucester. In an effort to save money on a contract, they didn't allow the design engineers to do their own inspection of the bridge before they started designing the project. They had to rely instead on reports that had been done in the past. And so when the contract was finally awarded, the construction contract was finally awarded, and the contractors got in there, they said, whoa, we need a lot more work done on this bridge. And so it resulted in a lot of change orders. The project ultimately had to be rebid. And what was supposed to be an $8 million project completed within 3 years has turned into a $37 million project. And it won't be completed until 2016, which is 5 years afterward. Now, it doesn't mean that 30 odd, I think the total bill now is going to be close to $36 million. It doesn't mean that all $36 million was wasted. But it means that had we had the appropriate information in the beginning, we could have designed the project differently in a way that really would have saved more money, that wouldn't have had all of these delays and the impact that it had on local businesses, because this was in downtown Gloucester,
right.
And it really has had a long-term impact on the local economy up there.
Not just the 2.6 million.
No.
Yeah.
So but it was an example of just not doing the right thing in the beginning, engaging in proper planning, comprehensive planning, and this is the result.
And perhaps proper sort of marketing. Communication is a better word.
Yeah.
Communication in the beginning, say this is why we need to do this.
That's right.
In the long run, it will save us money. If we had the $2.6 million back again, think of what we could do with it.
Oh, I know.
Solve
Exactly.
a lot of our transportation problems
Right.
And repair a lot more bridges.
Right, and that's it. And people talk about waste and abuse and fraud in government, and this is a perfect example of how it doesn't exist in big chunks. It's in small ways, and it just all accumulates that as a result of poor planning or poor contract administration, poor execution.
In your experience, that raises a question for me. What percentage or what's your view of the amount of waste that you see from this poor planning or poor investment in the beginning, poor preparation, as opposed to people waking up in the morning saying, I'm going to go, game the system?
Well, I think that there's much less. I can't put a number on
and
it,
I appreciate
but I can say that there's much less fraud than there is inefficient or ineffective services, and it gets manifest all over the place. I said that we audit every agency, every department on a 3-year basis. The exception to that is the state's Medicaid program, Mass Health.
Right.
I mean, you know that Mass Health takes up 1/3 of that $39 billion budget that you just passed. It covers 1.5 million people in the Commonwealth, and it is a very complex program. It acts in one respect, as an insurance, a health insurance company does with regard to those people, but then it runs a lot of separate programs for pregnant women or disabled children and the like. So it's got lots of moving parts. An audit that we conducted earlier this year looked at how well the managed care organizations that it hires to manage the care of about half of its members, how well that was doing at controlling costs, because that's the idea of managed care. You have someone that's coordinating it. All the bills are supposed to go through the managed care organization, and with the idea of being more efficient and providing better health outcomes for the families that are on the in the program. What we found, however, was that when, in many instances, if a doctor provided services to someone in a managed care program and sent the bill not to the managed care organization, but sent it directly to Mass Health was paying for it. So, in effect, Mass Health was paying twice for the services, because they were paying the managed care organization to not just coordinate the care, but pay the bills, but then they would also pay the provider directly if the bill came from them. And they didn't understand, the reason that it happened is they didn't understand themselves what the terms of the contracts were with their managed care organizations, and they didn't have so-called edits within their claims payment system to kick these back over to the managed care organizations. And we think that over the 3 years that we looked at, that this was a $600 million series of deficiencies that have led to this situation. So they're now obviously now in the process of figuring that out. They dispute the total amount of money, though they do acknowledge there were problems. But they've got to fix those now. I mean, $600 million over 3 years, that's a big, and even if it's only $200 million,
Right.
we can't afford to waste that kind of money.
Right, and it seems like a proper tickler system within the claims process would get it back.
I know. I can't condemn them, because I do realize it's enormously complex operation that they have there. And yet, again, it's a matter of the infrastructure of the agency and how well it is built to find these flaws themselves.
So what's the response of the agency that you get? You conduct an audit like that, you
Right.
reveal these problems, and I know they dispute some of the amounts,
Right.
although like you say, they realize the problem. Is it now working together with either your office or another agency to fix what's wrong?
They are in the process of doing that. They say, because we won't go back and audit
Right.
them for a bit. But what we have instituted since I came into office, because I don't want to wait 3 years or more to find out whether they've done anything, is that we do a 6-month check-in whenever we have so-called findings, whenever we find deficiencies in an agency's operation. We go back after 6 months and say, okay, so how are you doing?
Right.
What are the steps that you've taken? And we also ask, were the recommendations that we made actually helpful, and were they feasible? Because we want to know ourselves whether we are actually getting to root causes of problems. We don't want just agencies to apply just a bunch of Band-Aids. We want to make sure that we really understand what the dynamics are, and whether because in some cases agencies can't complete the work because they might need additional funding, or they need the cooperation of another agency. So we go back after 6 months and check in, and I've actually subsequently met with the Medicaid director, and we're confident that they are on the path to get this fixed. And that's generally what we find. We are finding about a 95% rate of complying with our recommendations. They won't all have been completed after 6 months. This Mass Health fix won't be done within 6 months. But we find that either agencies have done it or they say they are in the process of doing it. And so that's encouraging to us, and it should be encouraging to you in the legislature and to the taxpayers as well.
It is. It's an important focus because your office is there to help, and your office is there to put agencies back on the right track if through inefficiency or misunderstanding they come off of that track.
That's right. You know, although a lot of people just think of the auditor's office as a way to identify fraud, waste, and abuse. I see it a little bit differently. I see it as a way to make government work better, and that it's more of an active role, and it's really important to me that people understand that because. You know, I have a great respect for our institution of government, and I want people to share that respect. They might not have the same enthusiasm about it that I do, but if they don't have confidence that their money's being well spent, then they're not going to have trust in government. And I think that cynicism is contributing to the lack of voter participation. And those things really are of great concern to me because if we don't have a vibrant, engaged citizenry, our democracy is really at stake.
You're right about that.
Yeah.
And what I've learned, and sometimes people don't see this, is in Beacon Hill in Boston, we work well together, all of our agencies. In fact, the governor has said several times that he said, I'm not opposed to spending, I'm opposed to wasting.
Right.
And I think we all agree with that.
No, I think that's so. It's really, you know, having been, you know, first of all, many years ago a legislator, more recently a cabinet secretary, though, I can tell you collaboration across agencies is one of the hardest things to achieve. I mean, true working relationships. And I think that's really evident if you look at the Department of Children and Families. Without going into the litany of problems that have been laid bare over the past couple of years because of some really tragic instances there. What I think has to be realized is that the families that become clients of the Department of Children and Families have a range of problems: intergenerational poverty, substance abuse, mental health issues, physical health issues, sexual abuse, and so all those problems can't be solved by the Department of Children and Families. It takes the collaboration of all of those other agencies that meet those needs, working with those parents. And social workers, according to a survey that was taken by the Child Advocate's Office, which sort of oversees DCF, and also was borne out by conversations that I just recently had with Fitchburg State students who were doing internships at DCF, it reveals a lot of frustration and concern that there aren't good working relationships with those agencies, that it's hard when they identify a family in need, a mother in need of services, a father in need of services, to get the other state agencies to move those folks to the top of the list so that those kids can be protected and that family, that family, if possible, can be, healed, or if not, then the children's needs need to be met someplace else. But to hear from the survey that the social workers in general feel they have better relationships with law enforcement and schools and the courts than they do with their sister Health and Human Services agencies just reveals the extent to which collaboration has to be a greater emphasis.
And you're right about that.
Yeah.
And because it's hard, and I agree with you, it is hard, but it still needs to be done.
Absolutely.
And we're there to do the hard work.
Right.
And that also affects the care that we provide for our seniors. One of the important issues that we face is that if we have the opportunity to invest in programs that keep seniors in their homes longer, which they want, we save money in the long run on what we provide for nursing home care.
That's right.
And we can look at it that way.
That's right.
In the few minutes that we have left, I want to talk to you about one of the issues that is affecting our district, which is the Mass Department of Transportation, MassDOT, specifically the MBTA and the local bus services. We have a few lines that come up from the MBTA and one on the Lowell RTA.
Okay.
And there's a plan in place where we've put a moratorium on what we call the Pacheco Law to allow for some privatization of some of the bus services. And I know two bus lines that are earmarked for privatizations are the ones that come into Bedford and Burlington. Your office oversees essentially the program as it currently exists under the Pacheco Law,
Right.
where if an agency wants to privatize a service, they would come to you, you would conduct an audit and determine whether it saves at least a penny, whether it's sort of a draw anyway. It doesn't
Right.
cost anything. My understanding is in all the applications you've received, you've only refused a few, right?
Right. I'm sort of mystified by people who say that the privatization process that is in place, so that that requires agencies to make the business case before they decide that state government will no longer provide the service with its own employees, and instead they'll contract it out to a private, usually profit-making entity, is an impediment to effective government spending. I think it's an essential part of what the public rightly regards as accountability in government. Before you allow somebody else to make money off something that state government is doing, you should be making that business case. You shouldn't be motivated in deciding how you're going to operate state government by simply a philosophy that the private sector can do something better. You've got to be able to show that they will do it. You've got to know what your own costs are. You've got to know that you're paying a competitive price for the services that somebody else is going to provide. And you've got to have measures in place to ensure that the quality of the service is not going to suffer. So I disagree with the approach that the governor is taking, which is to forego that kind of required analysis and be a little bit more free in what you're going to decide to contract out, because the reality is the taxpayer still is on the hook.
Right.
Just because the private sector is providing the service, it doesn't mean that they've absorbed all of the costs of it themselves. They're still getting the money from the state government
Right.
to do this. And I think that those accountability mechanisms really need to be in place.
Yeah, here's what concerns me. We have people who work in this district that come in from Boston and Cambridge and Lowell, and we have people, and they service the people's needs here. We have seniors who depend on people coming in from these places
Right.
to serve their needs. And we have residents that need to get a bus to go to the doctor or other places. These buses may be running half empty or half full. As a government, we're going to make sure that those people have the transportation they need because they count on it. A privatized service it has a different motivation. Now,
Exactly
as a government,
right.
it may be that we can look at it and say maybe we should have buses half the size.
Right.
Maybe we should look at the routes, the scheduling of them. But that service needs to be there.
Absolutely, and if the motivation, as you say, is changed, and you're shifted from a public concern to a private concern, the needs of the citizens aren't necessarily always going to be uppermost in the minds
Right.
of that company.
You know that I sit on the Transportation Committee, and we have a situation with the trains. A private company, Keolis, runs the trains. Well, they're penalized every time they run late. They're not penalized when they let people into the train and they don't collect the fare. And guess what our problem is, right? They're running fine. They're just getting the people in quicker.
Right.
And we've got to address that because it's just a different motive. And it's fine, but it's not a consistent motive to getting that service provided.
No, and I think that people, I mean, there are a lot of reasons to criticize government, but I do think that trying to find those kinds of balances is a much higher priority for government than it is when a private contractor comes in.
Right. Well, Auditor Bump, thank you very much for being our guest with Rapping with the Rep. It's been a fascinating conversation. Hope you come back and
Thanks.
see us again.
Well, I've really enjoyed it.
Thank you very much. Folks, thank you for tuning into Rapping with the Rep. We'll see you again next time.